So good morning, everybody from Seattle, Washington. My name is Abigail Echohawk, and I'm excited to have you all here today as part of our Decolonizing Data, Strengthening Community Voices to Take Action for Our Missing Relatives webinar that is being hosted by the Urban Indian Health Institute in partnership with the National Missing and Identified Persons System, NamUs. We're so excited to have you all here as part of this webinar, and I'm going to go ahead and get us going here on time. I know that we're going to have participants rolling in for the next 10 minutes or so, but I really want to get to the real depth of this presentation, which is going to be our partners at NamUs sharing with us how we can enter in our loved and beloved missing relatives into their database system. So today we're going to be doing some introductions. I'll tell you a little bit about who the Urban Indian Health Institute is and our work in violence against women. We'll then have the NamUs data entry training where we'll all learn on how to, as community members, as tribes, as urban Indian organizations, as community and allied organizations, on how we can enter in our loved ones into the NamUs database. And then at the end, I'll go ahead and introduce this Community Days of Action, because here at the Urban Indian Health Institute, as we decolonize data for Indigenous people, by Indigenous people, that we know our resiliency has always been action. And it is because of the grassroots actions of communities across the United States and Canada and North America that this issue has not been allowed to stay silent, and it is a result of this action that we are here today. So in honor of that, we'll be introducing Community Days of Action for us to come together as communities across North America to enter in data into NamUs. We'll also have an opportunity for questions as the presentation goes on. If you have questions, please enter those into the chat box. We will go ahead and answer any questions that we are able to as the presentation is happening. If we're not able to answer your question and you would like to leave us your email address for us to get back to you, please do so. In addition to that, we should have some time for questions at the end of the presentation. So in particular, as our friends at NamUs are doing their presentation, if you have any questions for them, please enter that into the chat box and we'll make sure that they get those so that we can answer those questions at the end. So today we have a couple of presenters. Myself, I'm Abigail Echohawk. I'm an enrolled citizen of the Pawnee Nation of Oklahoma on my father's side. On my mother's side, I was born and raised in Alaska amongst the upper Otna-Athabascans peoples. And I am very blessed to be the director of the Urban Indian Health Institute and the chief research officer at the Seattle Indian Health Board. However, when I think about why I'm doing this work, and it really is because I am a member of an incredible community here in the city of Seattle and then nationwide within both my tribal communities in Alaska and in Oklahoma. And I think many of us think of ourselves as Indigenous peoples as being mothers, as fathers, as grandmothers, as parents, and as people responsible to ensure the health and well-being of those next generations. And that is the goal of this presentation, is to prepare a better future and to ensure the safety of all of our people and to do what we can to ensure that if they've gone missing, that they are represented in the data so that they can be found. And we are also blessed to have BJ Spammer, who is going to be doing the training with us, and she is the executive director of NamUs, and I will go ahead and do a more in-depth presentation when we get to her portion. So who is the Urban Indian Health Institute? We are one of 12 tribal epidemiology centers. These epidemiology centers are public health authorities, and we are funded by the Indian Health Service. UIHI was established in 2000, but there have been tribal epidemiology centers since 1996. And I want to say today we have representation from all 12 tribal epidemiology centers on this call. As tribal epidemiology centers, we are dedicated and we are directed by tribal leadership. We are governed by tribal leadership and we are responsible to them. And as such, all 12 epidemiology centers are on this call, and we're going to be working together to ensure that our communities have the knowledge and the support to enter in data if they would like into NamUs. Urban Indian Health Institute specifically, our mission is to decolonize data for Indigenous people by Indigenous people. We're a little bit unique in that the 11 other tribal epidemiology centers represent the Indian Health Service regions, the 11 across the United States. UIHI is the only one with a national scope that looks at the health and well-being of Native people who are currently living in urban settings. And so we recognize that many of our people live in large urban cities for a variety of reasons, and we want to ensure that their health and well-being is represented through data, through epidemiology, and through research. We are also the only tribal epidemiology center that is part of a Seattle Indian Health Board, a clinic that provides health services to American Indians and Alaska Natives. We are so excited and blessed to be able to support a network of more than 62 organizations across the United States, along with a multitude of others who would like technical assistance or to find out more about the health and well-being of urban Indians. So why are we doing this work? I've been asked that many times as to why a public health institute, a tribal epidemiology center, is working in violence against women. And why wouldn't we work in violence against women is my answer to that. It is our responsibility to honor our matriarchs, those women who are the culture bearers, who carry the next generations, and ensure that as the next generations move forward, that they are full of love, compassion, grace, and the knowledge of our ancestors who have come before us. As a tribal epidemiology center, we look at everything that impacts the health and well-being of our people. And that includes whether or not we are safe in our communities, whether that be in tribal rural settings or whether it's in the urban settings. So the work that we do, again, ensuring that we know the data on violence against women, and we are also doing prevention and intervention, is all about honoring our matriarchs. At the Seattle Indian Health Board, as part of the Seattle Indian Health Board, the Urban Indian Health Institute has released recently 2 reports, the first one in August of 2018, that looked at sexual violence against American Indian Alaska Native women living in Seattle. One of the findings of that was appalling to many people, including myself, that 94% of the women we had talked to had been raped or coerced into sex in their lifetime. This was one of the indications for us as we began to work nationally that the data that has been previously gathered truly has not been able to represent the amount of violence that has been going on in our communities. This study that we did showed some of the highest rates of violence that has ever been captured. And we understand as an institute that many of our people haven't had the opportunity to share these stories. So we think about all of the women in our studies as storytellers, and we have a responsibility to them and to their story. The second part of our series is one that many of you have seen, and that is our Missing and Murdered Indigenous Women and Girls study that was released in November of 2018. This study was led by Anita Lucchese, an incredible, brilliant woman who has been working in this for many years and has been working to capture data. We partnered with her and looked specifically at urban cities across the United States. And I want to be very clear, this data comes from urban cities. It does not come from the reservations or from rural cities. We focused again on this because it was the population in which we serve. One of the things that we found that there was more than 506 cases that we identified in 71 cities across the United States. However, we know that this is a gross undercount. This does not represent at all what is actually happening, and that's why we're hosting this webinar today. Because what we know is that from our study that there are multiple barriers that exist, not only getting the data, but ensuring the data is actually there. So we found police departments that were not willing to work with us and never sent information. We found police departments who were actually defaulting their data to white. If a police officer didn't gather the race and ethnicity of an individual, they automatically made her white within their systems, effectively hiding what was happening to Indigenous women. In addition to that, many simply weren't collecting race and ethnicity. And so several cities told us that they didn't collect the race and ethnicity of American Indians and Alaska Natives. So while we were looking to find what was the basic baseline of what was happening, what is currently happening in the United States in these 71 cities, we can't really say. That was really disturbing to us because we know that this data is so important. How do we know how to address what's going on in our communities if we don't even know that our people are represented in the data? And if in this data, particularly as we look at those who are receiving services from law enforcement, who are actually being looked for, if we're not in that data, then how do they know who is actually missing? And how do we know what's actually happening in our communities? When we looked at this report, we found that within the NamUs database, at the time of the report, there was approximately 116 American Indian, Alaska Native women and girls within that data. Since the time of our report, we know that that has increased minimally. However, we want to see that number double, triple, quadruple. I would like to see that number truly represent the number of those that are missing across the United States in our communities. And so we partnered with NamUs in this to bring you all together to train community members on how to enter within the NamUs database, because we know that this epidemic, this genocide, as it's being called in Canada, and I know is a genocide here in the United States, isn't just affecting this generation. It affected the generation before me, the one before that one, the one before that one. 500 years ago, as we began this time of colonization, we know that violence against women, violence against our people, that we have been going missing and we have been being murdered. Now is our time to call for action. And one of the questions we asked of those who signed up for the webinar is those who personally experienced the missing and murdered Indigenous women and girls crisis. 40% of everybody who registered for this webinar, 40% said that they have personally experienced that. That is completely unacceptable. And even this little data point is monumental, because how do we know this? How can we get this information out on how impactful this is happening in our communities, the impact it has on all of us? So thank you for everybody who shared this information. What we're going to do today is talk about how do we honor these community stories, because the stories of those who have gone missing or have been murdered are part of the fabric of our community stories now. How do we honor them? How do we honor the communities and the families? More complete data is absolutely the first step. And in fact, I do want to acknowledge that not everybody is going to be comfortable entering their data into a federal database. We know that just because it's there doesn't mean action is going to be taken. However, I strongly believe that we still have to be entering in that data for those who are comfortable in doing so. It gives us a means of advocacy, and it allows for those who are wanting to work with us to be able to see that information and begin to build towards finding our missing and murdered loved ones. However, because of that hesitancy, I would also like to offer for anybody who would like to send data of their missing loved one to the Urban Indian Health Institute to be inputted into our database, please do so. Also, the work that Anita is doing as part of the Sovereign Bodies Institute, she also collects information. So there's other places that you can send your data if you're not comfortable entering it into a federal database. One of the other steps we can take is family and community members taking the action to enter it into the NamUs database. And the other part is for many of us who may have the computer skills or even just the laptop to loan or the Wi-Fi somebody can sign on to support and to facilitate other individuals who may not have those same opportunities to enter their loved ones into the NamUs database. So today is about honoring stories, and it's about partnership that UIHI is having with NamUs. And I'm gonna go ahead and pass this on to BJ, who I'd like to introduce. So we are so excited to have this partnership with NamUs. And BJ Spammer serves as the Director of Forensic and Analytic Services for NamUs from 2011 to 2018. And in November of 2018, at the same time as the release of the Urban Indian Health Institute report, she assumed the role of Executive Director of Operations for NamUs. Prior to NamUs, Ms. Spammer worked for the National Center for Missing and Exploited Children, where she spent almost 9 years supporting long-term missing and unidentified deceased child investigations. She has also worked as an intelligence analyst for Kansas City, Missouri Police Department and the Kansas Bureau of Investigation. She holds a master's degree in forensic science from George Washington University. And I just want to say thank you, BJ, for doing this webinar with us. As again, we honor our community stories and we push for true representation within federal databases. And I want to thank you for doing this training for us, and I'm really looking forward to everything you're going to share.
Thank you so much, Abigail, and thank you to everyone at the Urban Indian Health Institute that made this webinar possible today and allowed us to be a part of it, because it's very exciting for us at NamUs to be a part of raising awareness for all of the tools and resources that we have to support families and tribal law enforcement and communities across the country to resolve their missing person cases. So it's exciting to be here to share our resources and to be a part of these community efforts to make sure that no missing Indigenous person is overlooked, that all of them are in our national NamUs database. So I will go through very quickly an overview of the NamUs program today, because I think one of the goals of the webinar for me was to make sure that everyone who is working within the communities to work with the families and to make sure these cases are in NamUs has a really good understanding of not just the NamUs databases, but of all the tools that we have to help resolve these cases. So I'll very quickly also touch on the forensic services and the investigative support that are provided by the NamUs staff members behind the databases. And from there, we'll really take a deeper dive into the database itself, because I know that we wanted that to be a big focus of today's webinar. So I want everyone to leave the webinar today with a really good understanding of how they can register and activate a brand new NamUs account if they want to be a part of entering cases into the system, how these community members can search for missing persons prior to making entries, just to make sure that they're not duplicating efforts, because these are important efforts. And we want to make sure that all of the volunteers and the advocates and the community members that are taking so much of their valuable time to get these cases into the system are entering unique cases, and we're not duplicating efforts. So we'll talk about how you can do those quick searches prior to entering a case. And then from there, we'll talk about how do you enter a brand new missing person case into NamUs. If there is a member of your community or a family member who's missing, as a community member, you can make that primary entry into NamUs. And I'll talk about what happens from there. I'll talk about how the cases are assigned to NamUs staff members that will work with those family members and with the law enforcement agencies from that point forward, to dedicate all of the additional resources that we have through NamUs to help get these cases resolved, because it's ultimately our goal is to bring these missing loved ones home and reunite them with their families. We'll also talk about how you can report additional information. If you see that there is a missing person already entered into NamUs, but you have data that you don't see in the NamUs database yet, I'll show you how to find the contact for that case and get that information reported, so that we can make sure that not only is every missing Indigenous person accounted for in the database, but that the entries are as complete as they can be, because the more information we have on every missing person, the more likely we are to be able to resolve that case. And I also want to preface everything that I talk about today by saying that all of our NamUs resources, everything that we do, from the databases to the forensic services to all of the people who support you behind the NamUs program, all of that is offered at no cost, because it's all completely funded by the National Institute of Justice. So these are free resources. They are available to every community, every family, every agency across the country. So again, I mentioned the technology, the database is not the only thing that we'll talk about, but we will spend the most time on that. But very briefly, I want to talk also about two additional big program offerings, our forensic services and our investigative support. And when I talk about investigative support, I'm really talking about the people behind the NamUs system. We have brought together subject matter experts from across the country so that they can work with the families and the agencies and really serve as a force multiplier. It's an additional set of eyes on every case that comes into the system. There's a lot of people behind the NamUs program that bring a lot of expertise to the table to help agencies to get DNA collected, get dental records, fingerprints entered into the database. And I'll talk about why we do that and how we use that data. But really, I think the first face of NamUs that most people see or talk to are our team of what we call regional program specialists, or RPSs. So our RPS team is a group of subject matter experts that are stationed across the country. So they work remotely so that they are closer to the communities and the agencies that they serve. And so we have 9 of them right now stationed across the United States. So if you were to enter a case into NamUs, this is the person that your case would be assigned to. So if you enter a missing person who was last seen in the state of Texas, you would be assigned to Michael Nance as your regional program specialist. And then that individual is there to walk with you every step of the way to make sure that we get that case complete. We verify that there is an active missing person report on file with law enforcement, and then we can get that case published and devote any other resources that we have to help resolve the case. And I'll talk about that as we go through the demonstration of how to enter missing person cases. We do need to ensure that all of the missing persons that are reported to NamUs are actively reported to law enforcement as missing persons. The primary reason for that is because we want to protect all of these individuals that are reported missing to NamUs. We want to make sure that this is truly a missing person and maybe not someone who is voluntarily trying to separate themselves from maybe a domestic violence situation. So we want to verify all of these cases are on file with law enforcement, and sometimes we do get reports from families who do have missing person cases that they've been unable to report to law enforcement. These regional program specialists can often help those family members by helping them to reach out to a different jurisdiction or helping them to connect to an investigator in that agency to get that case reported. So they really are a great resource, not just for the agencies, but for the families as well. And they're a wonderfully empathetic resource for the families. Everyone that works in the regional program specialist position has been with NamUs for a number of years, and they all come from extensive backgrounds in these kinds of case investigations. And also very briefly, I'll just mention, we do have forensic services, both for unidentified and for missing person cases. But strictly speaking about missing persons, what most of our agencies and families will need are the forensic odontology services. These are our forensic dentists that help to locate and code and upload dental information to NamUs. And they do that so that that information is then available for comparison if there were any potential matches in the database that needed to be explored. We have fingerprint examiners who do the same thing with fingerprint records. They'll help gather them, scan them, code them, upload them to the system. And the fingerprint records that we get for missing persons don't necessarily just have to come from criminal fingerprints. It's not uncommon for us to get fingerprints from a missing person who had to be printed for a pre-employment background check, or for a driver's license, or for a professional real estate license, or for some other civil matter. So we do often get fingerprint records for our missing persons that wouldn't normally be in a national database. We can load those into our system to compare against the unidentified decedents to make sure we're leaving no stone unturned. We also provide DNA analyses, again, free of charge, just like every other NamUs resource. And I do know that in some communities there is concern with providing DNA samples to be loaded into a national database. So I did want to explain or clarify a little bit about how DNA is used in missing and unidentified cases to alleviate those concerns, because DNA is a really important tool for resolving missing and unidentified cases. So just to give you a couple of quick points on DNA, and I'm happy to answer any other questions that might arise during the webinar. But to give you a couple of quick points about DNA, unlike some of the commercial DNA databases that you're probably reading a lot about in the news, like Ancestry and 23andMe, the DNA database that's used by NamUs and some other law enforcement agencies for missing and unidentified persons is called the Combined DNA Index System. And CODIS is the acronym for Combined DNA Index System. So this is the DNA database that's utilized for our missing and unidentified person comparisons. And it's a system that is restricted only to CODIS laboratories. So when family members provide DNA samples, those are loaded into the CODIS database where they can only be compared against the profiles from unidentifieds in the system. Those are primarily unidentified decedents, but there are some unidentified living persons represented in CODIS. Those are typically people with cognitive disabilities, impairments, medical conditions, something that prevents them from telling us who they are. So these are living individuals, but they're unidentified. So when family members provide DNA for their missing person case, they're loaded into CODIS only to be compared against those unidentifieds. They cannot and are not compared against any other profiles in the system. They're not compared against crime scenes or convicted offenders. They're not used for research. They're used strictly to locate their missing loved one. And those DNA profiles themselves are heavily guarded. We in the NamUs program don't even have access to those profiles. They're only accessible to the DNA analysts who need them to do those comparisons between the missings and unidentified. So if family members want to provide DNA, it's a voluntary process. They'll sign a consent waiver that allows us to send their DNA sample to the laboratory where it's profiled and uploaded to CODIS. And if for some reason the family wants to revoke that consent, they can do that at any time, even if their missing loved one's not been located. All they need to do is send a letter into the laboratory, and any of our staff members can help that family to find that contact and get that letter in to revoke their consent for that profile to be searched against the unidentified. So I hope that clarifies DNA a bit and answers some of the questions. But again, if we have more questions after the webinar, I'm happy to answer those. But I know we want to spend most of our time in the technology itself. So we'll start transitioning into the NamUs database. And I'll talk a little bit about the kinds of cases that we have in NamUs and how you can search and enter cases as well. But I want to talk a little bit about the kinds of cases so that there is a common understanding of what NamUs is developed and intended to be used for and what kind of cases you may not see in NamUs. As we all know, MMIW has been an important movement. We're seeing a lot of publicity, we're seeing a lot of agencies, a lot of reports, a lot of media on MMIW that's raising a lot of much needed awareness and prompting discussion on really important topics like the violence against Indigenous women and girls and missing Indigenous persons in general. MMI has become a really popular acronym and a symbol for this movement, and these continuing efforts are very important. But as I talk about NamUs, for the purpose of a NamUs discussion, rather than talking about MMIW, you'll hear me discuss missing persons separately from cases that involve homicide or cases where foul play is suspected. And that's because for the purposes of NamUs, missing persons are distinct from homicide cases or even sometimes unidentified decedents. And I'll explain that in the next couple of slides, but just to stress up front, NamUs is an operational database of unsolved missing person and unidentified decedent cases. Our main goal is to resolve these cases, and we do that a lot of ways. We do that by comparing the missing to the unidentified. But for the most part, the cases that go into NamUs are unsolved cases, so we don't necessarily have an historical database of homicides, but we may have some cases that do involve homicides in the unidentifieds. And even in the missing persons, we might have some homicide cases where the missing person's body has just not been recovered. But we will talk about missing persons, unidentified decedents, and homicide cases separately when we talk about the cases in NamUs. So just to explain that a little bit further, looking at our missing person cases, and looking at especially our resolved cases, I just looked at our resolved case resolution statistics the other night and was really happy to see that 75% of the missing person cases that have been resolved since they were reported to NamUs, 75% of those individuals were found alive. So I think that's a wonderfully hopeful statistic for our families of the missing. Most of our missing persons are being recovered alive, but of course we know we have a number of missing persons as well that we fear foul play has occurred. And if we look at the NamUs data, looking again at those statistics just last night, 13% of our active missing person cases do indicate that foul play is suspected in that missing person's disappearance. So these are typically cases that law enforcement refers to as no-body homicides. These are homicide cases where we're still trying to find that missing person. But as you'll see from this diagram, a lot of homicide investigations don't cross into missing persons at all. They are known victims, or, as I'll show you in the next slide, they're unidentified decedents. So again, just like the missing persons, we do have a lot of unidentified decedent cases that overlap homicide investigations, but we have a lot that do not. So 25% of our active unidentified decedent cases in NamUs right now involve a manner of death that doesn't involve foul play. So these are cases where the individual may have died of suicide or an accidental death or even a natural death that's caused by a disease or an illness. But we do see 16% of our active unidentified person cases are classified as homicides. And you'll see a gap between those two statistics. That's because a number of the cases either don't have a cause and manner of death listed, sometimes for investigative purposes, or sometimes just because the condition of the remains prevents the medical examiner or coroner or law enforcement agency from being able to definitively classify whether or not that case is a homicide. And just to give you a couple of quick statistics, and then we'll dive into the database itself and show you how to register and start entering and searching cases. I'm looking at the number of cases that we see in our database right now. As of June 1st, we have 118 unidentified decedents that are entered into the NamUs database whose race, ethnicity is noted to be American Indian or Alaska Native. And those cases are coming from 25 individual states. And I believe that these maps, there are larger versions of these maps and some other information that will be provided to the webinar attendees as well. Looking at the missing person side of the database, we currently have 383 active missing person cases in NamUs from 32 states where the missing person's race or ethnicity is noted to be American Indian or Alaska Native. So Abigail mentioned at the time of their study there were 116 cases. We're now at 383. So while we're very encouraged to see this statistic and the number of cases increasing, at the same time we know we still have a data gap. And we know there are a lot more cases of missing persons that are not yet entered into the NamUs database. So it's really encouraging and exciting, I think, to be a part of this initiative where the community will come together and contribute to helping us get these cases into the NamUs database. So we're going to skip over a couple of statistics in the interest of time. I want to really dive into how you can get into the NamUs database, start registering, start searching, start entering cases. This is where the thing that you need to start searching and registering and entering cases. So from NamUs.gov, as a public user, you can register for an account to NamUs. Now, you don't have to register. If you're a public user and you just want to explore the NamUs database, you can hit the Explore NamUs button that's over in the middle of the screen here and just do some searching of NamUs and look at case information in the database and what's viewable to the public. But you can also register for a NamUs account. And if you do that, you'll have some additional features that will enable you to enter a new case, track cases, print posters of missing persons. There's a lot of additional tools that will be available to you as a registered public user of NamUs. So to register, you would simply go to NamUs.gov and click the register link that's in the upper right-hand side of your screen that's highlighted with the arrow that you see in this screenshot. And once I hit register, and I apologize because my slide seems to be stuck, so I am going to exit out for a second here. My apologies. I am going to have to go full screen because my slide got stuck and will not progress. So let's go this way. Once I hit that register button, I'll be taken to the NamUs registration screen. So here as a public user, once you start your registration process, you're just going to select that you're a public user. The only difference between public and professional users are going to be our law enforcement users, our medical examiners and coroner users. They will have access to some additional information that the public does not see in NamUs cases, but that information is typically only limited to sensitive law enforcement information or personally identifiable information, information that's protected medical data like X-rays and medical records and prior medical conditions. That type of information is restricted just to our professional criminal justice users because it's sensitive. But pretty much all of the demographic information, all the identifying information that a public user would need to search for cases and find potential matches between cases, it is available to the public in NamUs. So you would start by clicking Public User, begin your registration process, and from the next screen, you're just going to be asked for some really basic information. You will give the system the email address that you're going to use to log in. You'll set your own password that no one sees other than you, and you'll set a security question so that if you ever need to change your password, you would enter a security answer and you would be emailed the process to reset your password. So you'll also be asked on this screen, when you register for NamUs, you'll be asked, how did you learn about NamUs? So we started collecting this data because it's very helpful to us to track the success of different outreach efforts, because we are trying to reach and make sure all of our law enforcement agencies in the U.S., including tribal law enforcement, we're trying to make sure that they are all registered users using NamUs, and that all of our family members of the missing and all of our advocates and community members are aware of NamUs. So if you'll let us know how you learned about NamUs, that's a very valuable metric for us. So after you enter that information, you hit next, and this is a very simple process. It's like registering for any other system that you've probably registered for. You'll be asked for your contact information, your name, your address, your phone number. This information that you provide is only visible to NamUs staff members, and because we only use this to reach back to you. If you were to enter a case, if you're especially a family member and we need to reach back to you for more information, this is why we ask for your contact information. So if you provide that and hit next, on your next screen, you'll just be asked to read and accept the privacy policy for NamUs. Again, pretty standard for any website that you register for. Now, once you hit the register button, you will be registered for the NamUs database. So you'll get a notification that your registration is complete. You'll have one more step before you can log into the system. You'll need to go check your email, and you'll have an email that tells you your registration's incomplete. We just need you to activate your account. So if you go to your email and click the Activate Account button, your account is now enabled and you're ready to use NamUs. You're ready to log in and start entering cases. So you'll get a notification that now your activation is complete. And if you hit the login button from there and log into the system, you're going to be at your central dashboard that allows you to do everything else that you need to do in the NamUs database. So from here, I'm actually going to jump out of prepared slides, and we're going to go live in the NamUs database to walk you through a demonstration of how to search and enter cases. Stephen, if you're on board, is there anything else that you wanted to mention before I log into the demo? Okay. And I apologize, I'm trying to also keep up with the chat window to see if any questions are coming in, but I seem to have lost that window during the screen share. So Abigail White, I'm sure you'll notify me of questions at the end of the demonstration. So now that I am registered for the NamUs account, I'm actually going to go back to the main screen that you will see now as a brand new user. As you go to namus.gov, now that you're registered, you're ready to log in. You'll hit your login button in the upper right-hand corner of the screen. And from there, you're going to enter your email address and the password that you just set and hit login. And I'm logging in under my public user demonstration account, so everything you see on this screen is what you will see in your screen, in your dashboard when you log in to the NamUs database. So the first thing I want to show you is how to search for a case, because before you enter a missing person case, we want to make sure that that person's not already entered into the NamUs database. So the way that I start searching for my cases is from my dashboard. I have a link up on the top bar to search missing person cases, unidentified person cases, or unclaimed persons. Now, I didn't mention unclaimed. Unclaimed persons are people who have been identified by name, but the medical examiner or coroner has no family contact information to make next of kin death notification. So we support those efforts as well with analytical searching. We can help locate those family members. But families who are missing a loved one can also search the unclaimed database, make sure they're...
This
yes, ma'am.
We're not able to see your screen right now.
Oh, no. Okay. Well, I'm going to stop then, and I'll reshare. Thank you for letting me know that. Oops, sorry. Are you able to see the NamUs database here?
No, we're still looking at your slides.
Okay, I'm going to try one more. Let's try this.
Now we can see it.
Thank you so much. I'm going to back up just a little bit to make sure you all know where to go then. So I've logged into the system. And after I log into the system, I'm seeing my central dashboard. And this is where all of my tools will be. So everything that I need to do in NamUs, I can get to from here. Now, I will immediately from my dashboard see a list of any cases that I've entered already. And so this is a test case that I entered this morning, so you'll be able to see that as well. Once you've entered a case, you'll see a list of all of your cases that you've entered in the dashboard. But before I make any entries, what I want to do is search. So if I go up here next to my dashboard icon, I see a search tool for missing persons, unidentified persons, and unclaimed. So before I enter any missing person case, what I'll do is I'll click to search and make sure that this person isn't already entered into NamUs. And one person I know we have is Larissa Lonehill. So what I've done is just tabbed over to the last name field. I can search by as much or as little information as I have available. So I can search by just the last name, and I see as soon as I've entered any criteria into any of these fields, I see that I have one search result. So if I hit the search button, I'll see a list of any cases that match my search, and I see that Larissa Lonehill is already entered into the NamUs database. But if I were about to make an entry for her and I have some information on her, I might want to skim through the NamUs database to see what we already have entered for Larissa. And if you had information that you didn't see in the NamUs database, maybe you had some additional photographs or you had additional information about clothing or tattoos, you can scan through all of the publicly viewable information in her case file. And if you had a piece of data that's not already entered into NamUs, if I click to this Contact tab at the top of my case header, I can see all of the investigative contacts and the NamUs contacts that are assigned to this case. So on the right, you'll see your NamUs contact is Jessica Hagar for this particular area because she covers the state of South Dakota. So Jessica Hagar is the point of contact at NamUs for this case. So you could reach directly out to Jessica, you could call her, you could send her an email if you had a photograph or something that wasn't entered into the NamUs case. So you could provide that to Jessica, and she'll make sure that if that information does need to be added, we can get that entered into the system. You'll also always see any investigating agencies that are attached to the case. So it might not be uncommon to see multiple agencies here. There might be a local law enforcement agency because you have someone who was living in an urban area. You might also have a tribal law enforcement agency, or you might have a federal agency like the Bureau of Indian Affairs. We can add multiple agencies to the case file so that everyone that's working on this particular missing person case all has access to the information. So from a case file, you'll see all the information that's available to the public, from demographics, her basic identifying information, height, weight, name, race, ethnicity, where she went missing from, what are the circumstances of her disappearance, what physical descriptors do we know about Larissa, hair color, eye color. We could even indicate scars, marks, tattoos. If we had information about the clothing she was last seen wearing, it would be listed here. We also have a section of the NamUs case file where we can upload all images, documents that pertain to that missing person. So you can add multiple images for your missing person. And if you click on any, you'll bring up a full size. And also comparisons. If there are potential matches that arise and law enforcement reviews two cases and determines that they are not a match, maybe they're an exclusion, those exclusions can be listed in the comparisons tab so that we don't get duplicate leads for the same case. So search for your missing person prior to doing any missing person entries, and I believe you'll also, anyone that's involved in the community event, I think will also be provided with a list of cases that they can reference before making any entries to make sure that we're not duplicating efforts. But once you know you have a unique missing person that needs to be entered into NamUs, from your dashboard, I click on my dashboard link, it takes me back to my main landing page. I have a link on the right-hand side to enter a missing person case. Now, I should say for the unidentified decedent cases, only medical examiners, coroners, and law enforcement designees enter unidentified decedent cases into NamUs. But everyone can make primary entry of a missing person case into the system because we encourage family members and friends and advocates to give us that information on the missing person, because a lot of times they're going to have the most robust data on that missing person. So if I'm creating a new missing person case, first thing I'm going to have is a short form that lets me very quickly enter a missing person case and get a NamUs case number. So I'll be asked, what is my relationship to the missing person? And I can select from any of these relationships. Maybe I'm the missing person's mother. Was there a missing person report filed with law enforcement? Maybe there has not yet, and you need assistance connecting to a law enforcement agency. But if a law enforcement agency was contacted, we'll also ask you, did that agency take a report? Because maybe we need to coordinate with a different agency if the family had difficulty filing a report. So if they took a report, you'll let us know that. And from here, we're really just going to be collecting the basic information for your missing person. What is their name? What is their date of birth? What is their sex, their race? So I have a female. I can select American Indian Alaska Native as the race ethnicity. And once I create the case, I'll show you where you have the ability now to come back and add even more data. So I'm going to enter when and where my missing person was last seen. So I'm going to enter a date of June 1st. And I'm going to use Virginia just because I have a regional program specialist in Virginia that knows I'm doing this demonstration. So when she gets this case, she knows that I'm entering a demonstration case. We do ask that you don't enter test cases, because once you start making an entry, this is an actual NamUs entry that you're making, and you will be assigned a NamUs case number, and then our staff will be assigned to respond to that case. So we want to make sure that the cases coming in are actual missing person cases and not test cases. But from here, I can enter when and where. I can enter any circumstances related to my missing person's disappearance. So I could say exactly where this missing person was last seen and what any circumstances might be. So you can be as detailed as you want to be here. Our regional program specialists will vet this data, and if they see pieces of information that maybe should be put in different areas of the case file, they'll do that. But really, you can be as detailed as you want to be in these case entries. You'll tell us the height and weight of the missing person, and you may have a specific height, maybe 5'4", or you might not know exactly how tall your missing person is, so maybe you want to enter a range of 5'4" to 5'6". Same with weight. I could enter a specific weight, or I could say I'm not really sure. I need to enter a range of 100 to maybe 130. I can select hair color. So brown hair, brown eyes, and on the rare occasion, we do have some missing persons that have a different eye color from their left eye to the right. You could actually discriminate between those two and tell us a different right eye color versus left eye color. So once I have some of that basic information filled in, I hit Create Draft, and this will take me to my full NamUs case file, where now I can see up here in the top of the case, I can see that I've been assigned a NamUs missing person case number. So if I'm the family member, now I have a NamUs case number that I can reference. And so up at the top of the screen, you'll see a summary of who this missing person is, and you'll see a lot of fields are flagged or highlighted with these orange indicators. This is telling me that there's still some minimum data that NamUs would like to have before we consider this case complete. And if I click Show More next to any of these notifications, it'll tell me exactly what pieces of data it's still looking for. So in the demographics section, NamUs is still looking for tribal enrollment or affiliation for this person because I said that my missing person is American Indian or Alaskan Native. So if I hit Edit, I can see where this information is that NamUs is looking for. I can see all the data that I've already filled in, and the reason that these fields are highlighted in orange is because they are those mandatory minimum fields that we would like to see completed for the most complete NamUs entry. But because I've selected American Indian Alaskan Native, NamUs is also asking me, was this person enrolled or affiliated with a federally or state recognized tribe? Now these are new data fields that were just added back in December of 2018. And they were added by request because we needed better tools to determine jurisdiction of some of these tribal cases. So we needed the tribal enrollment affiliation to determine jurisdiction. Should this case be reported to tribal law enforcement? Is it a local law enforcement case? Also so that tribes can have better records on how many people are reported missing from their tribe. So we can complete this information by saying, yes, this person was enrolled or affiliated in a tribe. No, they were not. We don't know whether or not they were affiliated with a tribe, or you can decline to answer that question. Again, the only reason this data was added was for tribes to have better information on their cases and to determine jurisdiction. So if that information, I think the more of that information that we collect, the more of that information we'll be able to give back to their tribes. So if I select yes, that they were, you'll see now that I have some additional fields pop up to where I can say whether someone was enrolled or affiliated with the tribe, whether it was a state or a federally recognized tribe. And now I can say what state that tribe is affiliated with. And if I say I'm going to stay in the state of Virginia because I made this person missing from Virginia. And now I can select from a pre-populated pick list all of the federally recognized tribes in the state of Virginia. So once I fill in those 4 pieces of data, I can hit this Add Tribe button, and that will add that tribal enrollment to my case file. And the reason I hit Add Tribe is because then that clears out these fields, and I could actually come back and enter a second tribe if someone is affiliated with a different tribe, maybe through marriage. So those are really the only mandatory fields because those were highlighted in orange. Now, if I had said no to the tribal enrollment question, I don't have to answer any additional questions. But if I said yes, we will be looking for what is that tribal enrollment. And now if I save that, I will see that in this particular card of the NamUs case file. I will see that she's associated with a tribe. And now up at the top of my screen, I can see NamUs is still looking for a required piece of information. So show more, and now I could see that in a different area of the case file, NamUs is looking for me to enter what county this person went missing from. So I can see I still need to select a county, and we'll just pick Alexandria. And I have a question here as to whether or not this location that this person went missing was on tribal land under the jurisdiction of the United States. So I can say yes, no, or unknown here. Once I fill that information in and save that, you'll see that that second orange box has disappeared, because now I've entered all of the mandatory minimum demographic and circumstance information. NamUs is telling me I still haven't entered an investigating agency. You don't have to enter an investigating agency to submit your case to NamUs, but we will need that before we can publish the case. So if you do have that now, if you hit Add Agency and go over to the contact screen, now you can add that investigating agency information. And you do that simply by clicking on these pick lists and selecting from the agencies that are entered into the NamUs system. And if for some reason you don't see the agency that you need, you can just type a note in as to who your investigator is and what agency. So if I save that agency information, now you'll see if I go back to the case tab, all of those notices have disappeared, because now I've entered all the minimum data that's needed. Now I could certainly come back and add additional data to any of these sections, and I can do that just by clicking Edit and adding that information. So I know we're running short on time, so one more thing, I'll just show you how to upload an image. Once I've entered my case file, I can click Choose a File, add maybe a facial photo or a tattoo photo from my computer. I can tell the system what kind of photo that is. It's a facial photo, and save that photo, upload it, and it will add it to my NamUs case file. So you'll just see, it's a very intuitive, simple system to use. You'll see now that I've added a facial photo, it's added that to my header as well. And I could continue adding additional photos that I have of tattoos, jewelry, scars, marks. And once all of that data is complete, now I can submit my case to NamUs. And once I do that, it's now assigned to a regional program specialist, and they're going to work with me from this point forward to get anything else that I need for this case. So with that, I know we need some additional time. I know, Abigail, you had an additional announcement you wanted to make, so I will wrap up my demo.
Thank you so much, BJ, for that incredibly informative presentation. And for everybody who's been submitting questions, we have been answering those when we are able to answer. And in addition to that, I know there are other questions that we may not get to. What we will do is we will answer your individual questions and email those to you. We will also post the questions without your names and post them on our Facebook page so that other individuals can see the answers to those questions, because there are some specifically related to the NamUs database. And so again, thank you. And I know we're getting close to the end of time here. One of the things that we wanted to do is that, and I would like to thank Michelle Demmert, one of our incredible advocates, for bringing this up in the chat box, that you know, it's wrong to actually place the responsibility on communities to be the ones who are ensuring that our loved ones are represented. We want to recognize that a result of institutional structural racism, the ongoing colonialism and genocide of our people, and the resulting invisibility of us, that this epidemic continues to be one that is pushed under the rug and is not seen. And unfortunately, there are things like this that are happening. In a perfect world, law enforcement would do what is right and would have entered into the correct databases and would have ensured that your loved ones were represented. And we shouldn't have to place the responsibility on the community to be the ones who are always doing it. So in knowing that, while there is opportunity for collaboration and to enter this data into NamUs, which I do encourage those who would like to, if you would not, if you're not comfortable doing that, again, you can send it to any information on missing or murdered loved ones to UIHI or to Anita Lucchese at the Sovereign Bodies Institute, who also collects this information. But we would like to give the opportunity for those who would like to do this, again, to use it to push for advocacy and to ensure that your loved ones are represented where you would like them to be, is that we have a map here of where everybody who registered, so from across the United States, we have participants, and we're so excited to see that, including all of the 12 tribal epidemiology centers. We are announcing Community Days of Action and an opportunity for all of us to take action together to honor our matriarchs and to ensure that our women, girls, and men are able to, and our LGBTQ, two-spirited, and non-binary folks have the opportunity to live the lives that they so deserve, and also, if they're to go missing or be murdered, that they are honored. And we are going to be organizing Community Days of Action, where we are looking at 4 days in July and in August, where we're going to encourage communities to come together to build relationship and partnership, and to come together to enter in data as a community into the NamUs database. We're going to hold a planning meeting as UIHI on June 19th for anybody who would like to join. And you can register an event with us, whether it be a round dance or a meeting at a Starbucks, whatever it is, a rally, a march, whatever you would like to do, you could register your event with us on these days. We will provide support. We have a toolkit you can use, including a recording of this webinar. We have press releases, whatever that we could think of in a toolkit, we have created for you to be able to use. And we would love to see community come together and enter in data in these Community Days of Action into the NamUs database. Again, these resources and then UIHI's assistance in facilitating collaborations. We've created a Facebook group. And for those of you, when you registered, if you clicked, we would like to hear more about what UIHI is doing around MMIWG, you will get this announcement in your email. If you did not and you would like to register, you can go ahead and go to our website, uihi.org, and you can sign up for our listserv, and you can get the information in that way. We're exactly at 12:01 right now. I don't think we're gonna have time to get to any more of the questions. Again, questions that need answered by NamUs, we will post those on our Facebook. We will also send those to the individuals, the answers to the individuals who asked those questions. And this recording will be available tomorrow morning. It will be part of our toolkit. It's also going to be saved on Facebook Live on our Facebook page. And we want to say thank you to NamUs and to all of the participants, everybody who is on this call, on this webinar, because you love your people. And that's why we're all here, because we love our people and we refuse for them to be invisible, and we refuse to let this violence continue. So I want to thank you all for joining us and thank NamUs for providing this training for us as we begin to hold our federal government responsible for also caring for our relatives in the way that we do. If you have any questions, please reach out to UIHI. Check out our Facebook page for the recording and for the question and answers. Thank you all for your time. And again, thank you for caring for our relatives in the way that you do.